everyone. So it's Q&A Friday. So we've got some good questions today. So I'll just get started. So the first question comes from Vanessa, and she asks, I was wondering what you do to keep your kidneys well. My roomie told me at my last appointment that it looks like my kidneys are starting to be affected. Is there an herb or supplement I can take to make it better? Well, the best thing you can do to help your kidneys is to decrease inflammation by incorporating lots of vegetables of different colors, eat organic to limit the toxin exposure, and to heal your gut by eating fermented foods like sauerkraut, bone broth, or even kombucha drinks, which gives your gut pre- and probiotics naturally. Reduce your stress levels and limit your intake of sodium, salts, and protein, as these can be too taxing for your kidneys. As for the supplements, I would highly recommend considering low-dose naltrexone therapy. I wrote about this or blogged about this. Link is there. You can ask your primary care or your rheumatologist. They might not be open to it. And if so, please shoot me an email or comment below. It's not a supplement, but it's a low-dose naltrexone therapy, which has a highly potent anti-inflammatory effect. You can eat lots of vegetables with variety of colors to get the antioxidant effect in your body, which will not only be anti-inflammatory, but also be proactive or protective for your cells as well. As for the anti-inflammatory supplements, though, you can also take some fish oils as well as curcumin. We have I would choose the highly bioavailable sources. And if you have questions about what I recommend, I will surely give you that link. So curcumins and the fish oils, and sometimes having a good quality probiotics to help you defecate or help you to poop is a nice little addition if you're considering some supplements. So I hope that helps. Second question comes from Victoria, and she asks, what are your thoughts on paleo diet to help with the inflammation? Well, I think that paleo diets are great for inflammation. However, I think that what may be even more beneficial is to incorporate a ketogenic diet into the paleo. So lots of research on the benefits of ketogenic diets lately, including anti-inflammatory effects, and I've personally had lots of success with it as well as with my patients. So it's the one that I want to kind of advise you to look into, and we certainly have something similar. I put a link to my blog this week where I talk about the ketogenic diets and fast mimicking diets to treat lupus and autoimmunity. Third question comes from Carrie, and she asks, how can I increase my energy? I feel most days like I'm only half alive. Then on days when I wake up and I'm myself, within a few hours, I spike a fever and I'm down again. So much to do and no energy or focus to do it. I'd really like to stop eating candy and soda just to make it through the day. Well, so autoimmune conditions like lupus causes mitochondrial dysfunction. That's the truth. And mitochondria is where we produce energy for our body, and it's within a single cell, right? And our immune system requires so much energy to function normally. But with autoimmune conditions, all meds cause mitochondrial insufficiency, which means it actually creates sick cells, which in turn creates extreme fatigue. Eating a high sugary food or a diet adds to the acidity of the body, and rather than supplying the cells with more energy, it has the opposite effect of spiking up the sugar levels, causing a surge of insulin to be released from our pancreas, which is highly inflammatory. So it's not what you want to do. So if you want to increase energy, decrease the toxic load through your diet, environment, and stress, coming back to that elimination diet. Then you'll need additional supplement supports for your gut like glutamine, probiotics, mitochondrial support, omegas, CoQ10, and even vitamin D, to name a few, to produce sufficient amount of energy or supply or help your cells to produce sufficient amount of energy, as well as for your immune system to function normally. Because for us lupus and autoimmune patients, our immune system is a our immune system is considered broken almost. So we must work to support it and fix it. And going back to the question above, LDN, low dose naltrexone therapy, might be just the thing you need because that's going to help you with the focus. It's highly potent anti-inflammatory. I've seen it do miraculous things in a lot of my patients. I'm on a low dose of 3 milligrams as well. If you need help to get a prescription for that, please comment below. I'll see what I can do with my colleagues. Okay, so last question comes from Lauren, and she asks, has anyone had success with treating leaky gut and having improvements with lupus symptoms? Yes, it takes time and diligence, but it's the only way to heal from lupus. I've done it and continue to do it on a regular basis. There are 3 things that we assume clinically when a patient has autoimmune condition. One is that they're genetically predisposed. Number 2 is that they had a trigger of some sort, a stress, infection, lifestyle change, whatever. It can be a move, some stressful situation of some sort. Number 3 is the gut permeability. So it's imperative, absolutely important to fix your gut ultimately if you want to get well. I hope you enjoyed these answers and I hope you find them helpful. If you like this blog or this Q&A, please like us on our Facebook page, Lupus Rebel, and subscribe to our YouTube channel, Dr. Connie Jian. And I will see you guys next week.